of it. That's what all the distance. That's a big thing with us. Find it. The bitch that close. Was this stuff? When we got some focus. It's always the real time set there. That's why we're always older, but I think right. We have the highest rating. So, because they're half share wage pay. We don't have not about quality. We keep on doing people, we just keep doing. You guys are such a demand, even the payers. It's the fines are. And their process. That's kind of don't just condemn society. On top of that, why is the leaders for not standing to apply to the contract? So we just give them. Yeah. For sure. So that's what it is. Yes. Well, the issue of the incentives here not shown. Right. So the incentives are really good. So now you got yes. You're not fighting. You'll have a contract. So the primary care is going into this because it's all going value based. Alternative models. So now the doctors have the money to take care of their patients. They're giving you the money. So you have the money. Take care of the patient better. Then you're going to pay the advocates. Okay. Yeah. So now you get there. Some of there, you're going to be able to grow their network. The incentives, well, I need to get to the yeah. Well, the conference of the I think it was quite How was lunch for everybody? Good? Ready to go? Can y'all hear me fine? Everybody's here for patient transportation. Right room. Hopefully everybody in the line can hear me. Quick intro here. My name is Jeff Byars. A couple of disclosures. I'm the owner of Sunback Moon, a private patient advocacy healthcare solutions company. I'm also president and EMS captain for Best Idea Volunteer Fire Department. That's back in Coleman, Alabama, where I'm from. And I'm treasurer of the Alabama Emergency Medical Services Association. The last two are non-paid jobs. That's strictly volunteers. The only one I'm getting money out of is my Sunback Moon company. Full disclosure, I do work for an accounting firm back home, but it doesn't really have anything to do with what I'm talking about today, so I didn't list it here. So, background, I have a bachelor's degree in accounting from UAB in Birmingham. I've spent 30 years as an EMT. I have worked for transport and non-transport agencies, special events, movie sets, done quite a bit over my 30 years as an EMT. Spent 14 years working for Blue Cross Blue Shield of Alabama. From there, I did Medicare and Blue Cross reimbursement audits. It's pretty well not a hospital in the state of Alabama I haven't set foot in. Done quite a few audits outside of the state of Alabama as well. Left Blue Cross, went to UAB, worked there for a couple of years, worked for their reimbursement for clinical trials. It's a neat position. Anything that was implanted in that hospital come across my desk for financial analysis. So it's kind of neat. Some of the stuff you'd see was like, wow, that's really out there, far-fetched scientific, to why did I not think of that? So you see a little bit of everything there. And then in 2015, life happened. my 7-month-old daughter, we found a tumor. She ended up with a diagnosis of a sacrococcygeal germ cell teratoma and misdiagnosed by 5 different facilities. I had been in healthcare my entire professional career. My wife is a biologist. We both thought we had a good grasp on healthcare, how to handle things. We got into this and realized we didn't. So that's kind of the quick and dirty of my story there. We went to several different facilities, but I'm not going to go into too much depth of that today. If you guys want my full story, I'll be glad to share that with you a little bit later. Once Claire got to the point where her treatment, she was outside of her difficult stage of treatment, I got back into the workforce. So I left UAB to take care of her and her treatment. And whether it was a luck thing, a God thing, or just sheer happenstance, I stumbled into the BCPA 3 days before they closed the registration requirement for the very first setting of the exam. So I have been a BCPA since March of 2018. I was one of the first 2 in the state of Alabama, one of only 9 that's in Alabama currently.
What's a BCPA?
Board Certified Patient Advocate. And then in 2020, I opened my own company. So what we're going to talk about today, medical transportation. That's my big background. I've been an EMT for 30 years. Been involved with a lot of it, from everything from local transports to out-of-state transports that I've done personally. We're going to go over some things to consider when you guys are working with clients who may need help setting up one of these services, how to arrange transport, and the cost of transport. Now, when I talk about this today, I'm not going to be talking about, oh my gosh, they're having chest pain, we need to call 911, they need an ambulance. This is going to be the family member who has somebody they've got a brother who's had a stroke out of state. They don't have anybody there to take care of them long term. They want to get them moved back closer to home, but they're not able to get in a car and make that 14-hour ride back home. Things like that. That's what I'm going to be talking about for you guys. And that's where, as advocates, we can come in a non-emergent setting, these transport situations. All right, a quick audience survey. Sorry if you guys are online, I can't see your hands on that, but how many healthcare providers we got in here? Nurses, physicians, any other EMS folks? Healthcare administration? Okay, I can talk about them. Well, I won't throw anybody under the bus. Foundations. Okay, we got some folks from foundations here. Independent advocates. Good to see you guys in here. Who's called 911? Who's been transported by an ambulance? Medical helicopter. Ooh, we've got one that's been flown.
My kids.
Your kid, okay, close enough. Anybody with fixed wing transport? Airplane. Sorry, I'll try to get into some of the lingo as we get into there. Right, so first off, our types of transportation. Uber. If they don't need medical care, they can go by private vehicle, taxi, Uber, Lyft, whatever means they can get there. A lot of the 911 calls that are responded to today in the United States could go by Uber or Lyft or private vehicle. I see it every day. 911 system's overutilized. So if you've got a patient or a client that's needing to get to the doctor's office, as a independent advocate, we're not really set up to transport these clients, but we could arrange transportation, have an Uber come pick them up if that's available, or a taxi or whatever may be available if they didn't have transportation. And this is going to be for your patients that's just like me, that's standing around walking, they just didn't have a means to get to the doctor or for their visit. Wheelchair van. Wheelchair vans are really underutilized in certain areas of the country. You see it a little more commonly in your metropolitan areas, but that's for anybody who is able to sit in a wheelchair. They don't have to be necessarily wheelchair bound, but if they're able to sit in that wheelchair, but they're not able to ambulate and move around. You may have an elderly client that they would be better off going by wheelchair. They may not use a wheelchair at home, they may use a walker, But if they're going to a medical center and they've got 2 or 3 appointments at one of these big university medical centers where they're having to travel 2 or 3 blocks to get from appointment to appointment, you may be better off to set up a wheelchair van to come pick them up, have that wheelchair, and have that wheelchair for them to move from appointment to appointment. A lot of your facilities have a wheelchair once you get there, but this sometimes helps even from the house if they're not able to get out to the car, and it's able to load them up in the van. They have the lifts and everything with them. Then we're going to move into the ambulance transports. Okay, we got 2 segments of ambulance. We've got our emergency and our non-emergency. Both can stem from a 911 call. Okay, you call 911, it's an emergency to you. Ambulance gets there. It's not necessarily an emergency transport for the hospital. There's a lot of these that take place every day. They're driving with traffic to get you to the hospital. Non-emergency call. Facility to facility. These can both be emergent or non-emergent. Okay, if you've went into one hospital and they deem you need to go somewhere else, stroke center, cardiac, whatever it may be an emergent transport to that other facility. Or it could be a non-emergent transport to another facility that they just need to get you from A to B, even with a cardiac patient that may not be an emergent, but they've got to get there for bypass surgery the next day. Not anything emergent, but they've got to get them there. We've also got the scheduled visits, and this is where you guys as independent advocates and advocates working with healthcare providers can come in for doctor's appointments, dialysis visits, that, whether it's, maybe even to a scan. When I was working on a truck back home many years ago, there was one particular hospital that did not have MRI capability, and they had a mobile MRI unit that went from hospital to hospital. It was on an 18-wheeler bed. And sometimes we'd have to chase down where that mobile MRI unit is at. Most hospitals have that capability now, but with technology always changing, there's always going to be something new that not every facility's got. They may have to transport that patient just for imaging. Within our ambulance transports, we got a couple of different types. We got our BLS, the basic life support. These are going to be staffed with an EMT or potentially higher. It could be a paramedic that is on a BLS and they're doing a BLS transport. These are going to be your calls that they don't have an invasive procedure. They don't have an IV established or need an IV access. It's essentially going to be vitals, basic stabilization if needed, and transportation. They're there to monitor if anything changes, document changes, relay that to the hospital, and go from there. If they need a more advanced team, they'll call that in. These can be emergent or non-emergent. One example comes to mind: Little League ball games, Little League football this time of year. Kid breaks their leg, football. BLS truck can handle that. They don't necessarily need a paramedic. So a lot of these that you'll see in ambulance staff, and some of these may be a BLS service. Depending on the scenario, they may escalate that and pull in an intercept for an ALS team to come in, but you do have that difference there between the two. And there's a difference when it comes into billing, whether they bill for an ALS service or a BLS service. Can include oxygen therapy too. The BLS service can do oxygen. All right, we're going to jump up to the ALS. This is advanced life support. You get your cardiac monitoring, your IV, whether maintenance or establishment, drugs, a lot of different things go on here. There's 2 different levels for the advanced. At least this, I'm speaking from Alabama standpoint. It does vary some across the country, state to state on there. Advanced EMT is kind of the middle ground there. They do have IV capabilities along with some drugs. Generally speaking, the cutoff there is cardiac drugs. When you get into the cardiac type, you get into the paramedic level. Then we move on to critical care. This may be one that you guys would be a little more involved with. This is a patient that is going to be transported a lot of times from one facility to another. They may be going to a higher level of care, and they need that critical care to get them in between A and B, more so than just a paramedic would provide on a truck. These critical care units are capable of RSI, which is a rapid sequence intubation, where they can actually use paralytics to intubate the patient and control their breathing if need be. The crew is sometimes specialized depending on the needs. Back home in Alabama, UAB uses one. They have a critical care transport unit at the hospital. Sometimes you'll have a critical care unit come from outside to bring a patient to UAB, Other times, UAB will actually send their critical care transport unit to the other facility that's sending this patient to bring them in. When they do that, they know what they're going to get. They know what the patient has, what medical equipment they're using, what their issues are, and they may specialize that crew. It may not be a paramedic on board. It may be an RN and a respiratory therapist, just depending on what the need is for that patient. Sometimes you will catch a physician on one of these. It's rare, but sometimes you will catch that as well. We'll move on to rotor wing transports, helicopter. When you're talking to somebody to set one of these up, they're going to distinguish between rotor and fixed wing. Helicopter transports are going to be a critical care level transport anytime they're out. They're not running just paramedics on these. It's a critical care level paramedic, nurses, respiratory therapists. Sometimes there's physicians on there. The crew on these, again, is sometimes specific to the patient, depending on what they're going to pick up. Pediatric patients, especially. Got a very good friend of mine back home that is a flight nurse with Children's of Alabama. Their flight crew works on the floor in the hospital assisting during their shift. And when they get a call, it depends on who's going on that helicopter. The helicopter come to their landing pad, pick them up. It may be a respiratory therapist and a nurse that goes. It may be two nurses. It just depends on what kind of patient they're going to pick up. Most of those type crews that do specific to the situation are not going to be your emergency scene flight crews. These are the ones that are going to be going to another facility to pick somebody up. They're not going to be landing in a parking lot or a field. They're going to a facility to pick somebody up. Fixed wing transports. We've got a few different ones here. You got commercial and private for transport. Just on this first slide here, commercial, your Delta, American, Southwest, commercial flights, similar to our Uber, taxi. If it's somebody that just needs to get from A to B and they're on oxygen, they can go on a commercial airline. They can go that commercial flight. If they're on a wheelchair service is great. Had a friend of mine 2 weeks ago that was touring up in the coast of Maine, and on the rocky coastline up there, sprained the ankle, just something awful. He utilized the wheelchair service at the airport just to be able to get him through everything without having to walk on the knee. So you've got the resources at these airports to handle this for patients if they're just going from one place to the other and otherwise able to go by car or plane on their own. They may need assistance getting through things. When you set these up, if it's a commercial flight, let them know at the check-in that this person is going to need medical assistance. They'll have those wheelchairs ready for them. There's additional lines that they can go through TSA to help navigate some of that at some of the busier airports. So some of that can help if you set that up in advance. Now we'll move into the medical transport planes. These are all going to be critical care level. This is when somebody's needing to get from facility to facility. It may be from across country, or it could be across the globe. A lot of things to consider with these, and I'll get into that here in a few minutes, but the most confusing part for these is there's a lot of services that provide it. There's a lot of different companies out there, and some of them, even their names are really confusing. Who's ever heard of Angel Flight? Is the one you're thinking of a free service or a paid service? Paid. There's paid, and then there's some free ones out there that are set up as nonprofits that do some charity work on there. Crews often specific, just like the others. They do long haul worldwide. There's also some membership plans, and I'll get into that here in a few minutes. So things we need to consider with these patients, no matter what mode of transport we're doing, doesn't matter. One rule of thumb we've got to have: if it fits, it ships. Okay? If they can't fit in the airplane or the helicopter, they're not going to be able to go by airplane or helicopter. Give you guys some examples here, and this comes from the crew itself, the ability of the aircraft that they're in, the equipment they've got. All of that can be size dependent. Well, let's face it, we're getting larger as a nation. People are getting bigger. When I started in EMS 30 years ago, this was our typical stretcher. You'll see it on TV a lot of times. Now, anybody got a guess at what the weight capacity of that is? Close. 300 pounds. This is closer to what we're using today in EMS. Anybody want to take a guess at the weight capacity on that one? 700 pounds. On a standard one, there's bariatric versions that will go up to 1,600 pounds. Now, if y'all have been to Walmart at any given time in the last 6 months, y'all know there's people that are pushing the 700-pound plus limit. And an ambulance crew is going to have 2 people on it. So size is definitely going to matter in this situation. You've got to let that transport crew know, especially if this is a scheduled transport, it may be they need to send 2 trucks out there just so they've got the personnel to help physically move this person out of their house or out of the facility into their truck and then wherever they're going. Different sized helicopters. I've worked scenes that have flown out of both of these. I'm not in the military. The Chinook was actually brought into a scene to lift a crane off of a patient that had flipped over on a construction site. I think it was a 26-ton crane. Man's legs was pinned underneath it. They brought in the Chinook to try to lift the crane up. Too windy for that. They couldn't keep the crane close proximity, but they did once they got 2 other cranes to pick this one up off of him. They did transport him to Birmingham from Coleman in a Chinook. Went from about a 30-minute flight to about a 9 to 10-minute flight. So, thing to consider on stuff like this, just kind of as a side tangent, that Chinook's not landing at the hospital. So they had to land it at the airport, have a ground crew then transport into the hospital. Crew size also matters, especially with the helicopter services. They may change their patient weight capacity every 12 hours with shift change. It depends on what crew's on there, what capacity they've got left, lift capacity of that helicopter. So they need to know that where they can schedule, and it may be they have to schedule these certain 2 people to work on that day to make that flight if it's going to be a scheduled transport. Our travel radius is another thing to consider, depending on how far you're going. This is a flight ring pattern from where I'm at. We're fortunate enough we have a helicopter service based in the county that I live in. And you can see they go on up in, this is the Tennessee state line right here. And so they do go on up into Tennessee, and you'll see there's Birmingham. So from where I'm at here in Coleman County, it's about a 20 to 30-minute flight to Birmingham. Radius, we've got to remember on that, it's not necessarily just time. You've got fuel consumption you got to consider on that. And this is whether you're going by air or by ground. You know, everybody's got to stop and fill up with gas at some point in time. Same thing with these ambulances. The ground, we have, oftentimes it is limited by our time. And the process on that, they're not dictated to ambulances like our truckers are as far as the time they can drive. But most services are not going to pair somebody up that's going to say, we need you to drive 12 hours and just go that direction. Tammy has informed me of a case. She's had one that did transport, but they had multiple drivers on board where they could rotate the trip to get them across country by ground. But that had to be scheduled, had to be set up. So we've got to think of that and keep that in mind. Another thing to consider, preference. I didn't get a laugh from anybody. No 18 fans. I'm dating myself for this. The VA had to be drugged on every show that they went on a flight anywhere. He would not get on a plane. He was scared to death of planes. That character would not get on a plane without them drugging. And the same thing happens to the general public. Anybody we deal with, you may have somebody that is just absolutely bound and determined they are not going to get on that helicopter. They're not going to get on a plane. They're going to go by ground. It doesn't matter if they're going coast to coast. They'll take it by ground. They're not going on a plane. It's just that way. So we need to consider what our clients are looking for. What's their preference? Membership, travel insurance. A lot of times people will take out insurance if they're traveling overseas for medical return flight if something happens on there. Some folks have a subscription to that where they've got medical transport all the time. The helicopter service that's in my hometown is one of those subscription-based services. It's not an insurance, it's a subscription that you pay. And if you fly with that helicopter, anything your insurance doesn't cover, they're going to write off to their members. They're not going to have to pay the additional fee on that. So, if it's somebody you're looking at a helicopter flight from one facility to another, find out if they have a membership, because that may dictate to you which service you want to go with. Because you may be because oftentimes these type transports, if it's not a medical necessity, if it's family request, it's not going to be covered by insurance for them to make that flight. But if they have that insurance, they may, or that membership, they may be able to make that flight and it not cost them anything. So if you've got options there, that may, take that down to a minimal cost, if no cost, from, several tens of thousands of dollars worth of flight costs here. Other things to consider: do we need to layover? Is this person actually capable of lying on that stretcher back of an ambulance to make a 20-hour trek across country? Any of y'all want to sit in the car that long? It may be you want to schedule a break somewhere in there that they get out. They may be bedbound, but I can assure you those ambulance stretchers are nowhere near as comfortable as a hospital bed. And y'all all know those are not all that comfortable. But it's a break for the patient. It's a break for the crew. Sometimes you can schedule these if there's a handoff. You may have a ground service that is going to drive from where I'm at. Sometimes if they're going out west, they may make it through Mississippi over into Arkansas or Louisiana and stop and meet another crew and hand off, and then another crew continue on. That may be a good spot to pick a rest area for this client. That used to be a little easier thing to do pre-COVID. After COVID, anybody else notice that nursing home beds are hard to find now? So used to, you could find, depending on the level of care they needed, you might could find a nursing home that would take that patient for a day or two to just have that transition to then continue on that journey to the next spot. A little tougher now, but it is things we need to consider. All right, anybody got any questions so far? Comments? So what do we need to do if we need to arrange transport for one of these clients? First off, we got to have a receiving facility. We got to know where we're going. Any trip we take, we kind of need to know a plan of where we're going. All of you guys knew where you were coming to come here. So we've got to have a plan on that. Receiving facility might be home. It might be their home. It may be a relative's home. It may be another hospital. It may be a nursing home. All different types of this, but you've got to have some destination in mind of where you're going. If it's a facility, if it's a patient's family and they say, yeah, bring my brother on, he's coming to stay with me, that's usually okay. But if it's a facility, you've got to have that confirmation from that facility that they're going to accept that patient. Whether it's nursing home or ambulance, you've got to have that confirmation from them. They may not have a bed available, and your transport may be tentative until they get a bed available. The last one of these that I set up was a gentleman in Las Vegas whose family was in Seattle, and they were transporting from one to the other. The receiving facility did not have a bed available, and we had everything worked out with flight crew. Flight company was ready to go. All we had to do was call them, but we had to wait on the green light from the receiving facility for them to get a bed. They give me an update, and of when they thought that might happen, but you never know in healthcare how long somebody's going to stay in or what else may come in that would take a bed and take away from, somebody that's already at a facility that's just being a transfer just for convenience of the family to be close. Contact their dispatch. Don't email. don't text, call the company's dispatch. There's so much information to be conveyed here. It is so much easier to do this with a personal phone call. They may ask you things you don't know. It's okay if you've got to go back and find out that information and come back. But it's real difficult in emails and texts and online forms to get that information in there. We went through a lot of different variables here between the flight crews, the patient themselves, the modes of transportation. There's a lot of things that go into play here. So call them to find out. Find out what options they have available. Other things you may find in this process is if they're going fixed wing for a long transport, what kind of fixed wing? Is this jet? Are we talking about a King Air? Are we talking about a prop plane? What kind of plane and what's available? A lot of these, especially the fixed wing services, they'll be based. The company I dealt with, this gentleman my example, they had a base in Las Vegas. Was that plane there when I first contacted them? Plane was in New York City. They had flown a patient there, and they will leave that crew in New York for as long as they can till they find another flight. So just because there's a fixed wing aircraft where you're at doesn't necessarily mean they're ready to go at a drop of a hat. It's similar to trucking. You'll see truck drivers, they don't want a deadhead and have an empty load coming back. Same thing with these guys. It's cheaper for them to put them in a hotel for a few days, wait till they get that next flight. And then what happens then? If you need that flight in Las Vegas, what are they going to do? You're going to pay for that flight from New York to Las Vegas to pick that patient up here in Seattle. The other thing that gives you, though, is it gives you options. If you've got a patient that can wait, it's not an absolute, we've got to go today or we've got to go next week. You can negotiate for them. Next time that plane gets back in Vegas, let me know. And then you've got it cheaper. Somebody else has paid the expense of that flight coming to that location. It may not be that they get to Las Vegas. They may be in Denver, but it's a lot closer than it was from New York. When you talk to these dispatchers, these are the different things you're going to find out within their system of how things operate. I mentioned earlier coordinating with multiple agencies, the need to hand off. Healthcare coalitions, anybody familiar with those? A lot of times our nurses are familiar with them. Most states and areas have healthcare coalitions that are kind of independent groups that different healthcare providers will join in on. A lot of times they can help you coordinate that of, I've got a provider that can carry this person to Jackson, Mississippi. Well, let me contact coalition in Mississippi and find out what all is available in Mississippi that might could take that patient on then into Texas. Air usually coordinates any related ground transportation. So if you're flying this patient, use my example from Vegas to Seattle, when we had this set up, negotiated with them, they would handle all of the ground transportation from the facility that this gentleman was at to the airport and then at the destination. What ends up happening with these, the flight crew is responsible for that patient. So the ambulance typically will go to the airport, pick up the flight crew, take them to where they make sure what they're picking up the patient is what they thought they were getting, that it's, what they can handle. That crew does patient care all the way through, but they've still got to have that ground transportation at the front and back end on there. So they coordinate that. Usually, COVID has changed things. Y'all all know how hard it is to find help now. There's everywhere you look, help on it. People needing, everybody's needing help. EMS has been affected by that as well. That has impacted these flight services' ability to coordinate ground crews. They don't have as many crews available. Birmingham, Alabama, there's sometimes an hour plus wait now for an ALS ambulance on an emergency 911 call. They have that big a shortage of folks in EMS. So you take that shortage and then try to schedule in, we're going to land at the airport at 6:15 this evening. We need an ambulance sitting there waiting on us. It's difficult to schedule that. So you may run into a situation that the flight crew is going to throw a contract at you that says you need to schedule ground transportation. And by the way, this is our hourly fee that we're going to charge if we're sitting here waiting on the ambulance to get there. They don't want to have to be sitting there on that plane on the tarmac any more than anybody else does. So our cost of these transportations, let's talk a little bit about that. When you're negotiating these rates, and most all of these, if it's going to be the type transport that is for convenience, it's not a medically necessary, it's going to be something you can negotiate. Most of your cross-country trips are going to be that way. It's usually not medically necessary to get from Alabama to Colorado. Okay, there's usually, no matter what you've got, there's somewhere in between that's going to be a little easier to get to that insurance, Medicare would deem this is where this patient needs to go. But if you're doing one of these long hauls and you're scheduling it, the cost when you go to negotiate, it may vary from the type of aircraft. The example I give out of Las Vegas, they had 2 different planes that were based there. And there was about an $8,000 difference between a jet and a prop plane. So depending on the financial capabilities of your client, who, maybe they're okay with paying that extra $8,000 to go ahead and get them there in 2 hours. Maybe a 4-hour flight is just fine if they can say that. Regardless, when you negotiate these rates between, hey, where's this plane at? What can we do to get it cheaper? Can you accept this amount? If it's a company that has a contract with Medicare, and you see this especially in the ground ambulances, they cannot go below the Medicare rate. So look that up. If you know it, ask them what that Medicare rate is. Usually they'll tell you. That's kind of where I try to start is what's the Medicare rate on it and see if we can negotiate if it's self-pay to get paid at that Medicare rate. Timing, I mentioned some days may be cheaper depending on where aircraft is at. Same thing with ground services, especially now that they're all short-handed. Some days they may be better equipped to handle that, and they may be able to give you a better rate on it. Available resources, I mentioned the different planes, different rates on that. There's other stuff to consider in this. Oftentimes that comes in if you're dealing with somebody out of country that they're going to pick up and they're bringing back here. Is there a runway that's adequate for the plane to get there? What are their regulations for flight crews? Can they get in and out? That's things that you're not going to know as an advocate, but that flight crew, they're going to have to go back and research if it's somewhere they can, go in and out of. So we've got our insurance costs, we've got our cash pricing. The other thing that drives this is competition. Especially with ambulance services, it's a little more difficult now that they're not as staffed as well. But especially your bigger cities, they've often got several ambulance services. Don't stop at just one. If this is a self-pay and you're having to find this out and get it done for your client or a patient, call a few different ones. Find out. You might find one that will do it a lot cheaper than another service. It may be a small service that just doesn't have the extra trucks, so they're going to charge a premium for doing it, versus one that has 300 trucks in their fleet and they'll move one from another city if they have to handle. Charity is another thing to consider on there. You guys with foundation, which foundation are you guys with? PAN, okay. Do you guys provide any funding for transport? You do? Okay. So there's an option for you right there to reach out to. Charity care, there's a lot of different scenarios on that where PAN or even other organizations will come into play here. There are corporate setups. A lot of times these big companies will have a jet that they have leased. They may not own that jet, but they have leased it for X amount of flight hours per month. And if they've leased it for 20 hours for that month, they've only used it for 15, they're going to pay for that last 5 hours that month regardless. There are some groups around across the country that coordinate and try to fill in with that, and these corporations will do a flight transfer for somebody for no cost, just for the goodwill out of it, because they've already paid for that time on that jet. Now, you're not going to get your person that needs a respiratory therapist and 2 flight nurses with this, but if you've got somebody that is wheelchair they're able to get up and make a few steps. They just don't want the hassle. It's tough for them to go commercial airline. That may be a route for them. There's groups that do that you'll see it a lot of times for cancer treatments. If a person is flying to a different facility to have cancer treatments, there's some options on there. And there's different groups all around the country. I wish I could give you a list all inclusive of that. Unfortunately, I don't. But that's something to keep in mind is there's other groups that will do some of this for you. Any questions? Y'all have been awful quiet. Sure.
Now, when I was looking for transportation to transport my client from Alabama to Colorado, it was self-pay. It was cash pay. And every place that I called, depending on flight versus ground transportation, it was all, private pay. So are you saying that there are some companies out there that do take insurance?
Most of your ground transport services do. That's their bread and butter is Medicare. That's, the 911 transports is not where these companies make money. They make money on their interfacility, their nursing home, their dialysis transports. That's where the money is at in ambulance transports. And all of those are going to be Medicare contracted companies that will take a Medicare rate. You're still going to be a cash paying customer on that, but they can't give you a better rate than they do Medicare.
So what's happening in my area, I'm social worker, I work with patient, patient advocate for Byars, Alabama, and North Carolina, Georgia, Florida. And what we're seeing right now is that they're all booked up taking dialysis patients from the hospital to the nursing home. So, they have Medicaid and they're using, motive care, logistic care. They're already kind of, backlogged with those kinds of, issues. So trying to get patients to infusion centers and things like that has been especially difficult. So what they're doing now is they're putting patients that should be wheelchair on stretchers, so they can take them in and they're not offering stretchers into an ambulatory care infusion. So that's a whole other issue. They don't want to transfer the patient. They're dropped and there's not room for it and all that. And there's just the biggest thing I've seen too is that these Medicare Advantage plans now are saying we'll do X amount of transportation a year, and so they kind of logistic care and Medicaid transportation has taken on all of those. I wish we would see some other companies doing it because lots of times are understaffed, getting patients called the night before, we can't take you for your MS infusion tomorrow. And now I have all these Medicare Advantage patients on top of the Medicaid ones that couldn't transport to begin with. It's just been kind of a disaster.
A lot of that is stemming from the lack of workers in the EMS field. And I will tell you the pay rate for EMS, for paramedics and EMTs is nowhere near what nursing is. That's part of it. I don't know what the solution is. I know it would be great if they were able to increase the pay. If you listen to the ambulance services, they'll say it's because the pay rate is not enough for them to increase the pay. Where that fine line is at, I don't know. I know they've lobbied a lot for it. In Alabama, they've pushed a lot for it. And the Medicaid pay rate is just so low on that is what a lot of them say on there. The other issue they have, in addition to staffing shortfalls, the trucks themselves. Back home, the ambulance service that operates the entire county that I'm in, they are down 2 or 3 trucks right now. And have any of y'all tried to buy a new vehicle lately? Have y'all seen the car lots? Just for your private vehicles, they're slim inventory. You go trying to buy an ambulance and you're looking at a year to 2 years out to get a new ambulance. The fire department that I volunteer with, we signed a contract on a mini rescue pumper in January of 21. And I got a text from our chief just a little while ago. We were expecting delivery when we signed the contract, 5 to 6 month delivery. That was right before all of the supply chain issues hit. Our latest update before I got this text was this month we would receive delivery of it. And now we've had another update on it that it's not going to be in this month. So we're over a year and a half out on a truck that went on a commercial cab and chassis, just put the bed on it, the pump. Like I said before, it would have been 5 to 6 months. They're running the same thing with ambulances. The ambulance service local to where I'm at, actually, Alabama requires, they've got strict rules on it, on the labeling, the branding of the ambulances, what, they've got to have on the side. They've got to be colored alike, look like where it's identified what service it is. The service where I'm from has got an exclusion from the state of Alabama, and they are now running 3 different color schemes on ambulances because they bought some used trucks that they just have not been able to slow down long enough to run through a paint booth to even paint to look like. So we've got one we've got an orange and blue one that everybody calls the Auburn ambulance that floats around town. The color scheme of their main ones is white and a lime green color, and then they've actually got a red one. So it's supply chain is hitting beyond just the people to work. It's the actual physical vehicles to get these patients from A to B.
I just figure out reasons. I'm working with a family that I helped move from South Carolina to Arizona. A lady just under Medicare age who doesn't have any family in South Carolina was moving to Prescott to be closer to family. She's got interstitial lung disease and needs a transplant. So she needed to transport, to Arizona, but can't fly because she had pneumothorax, healing, but, risk. And so the family rented an RV and they, took turns driving her over 5 days. Now, my concern was, what if something happens? Are they going to be able to identify any warning signs quickly enough? They're going to divert to a hospital. They're not going to know her care. So there's an advocate in Phoenix that I have met recently who has a business transporting patients, both recreationally, so patients that have chronic medical conditions, they want to travel, but they have medical needs, need someone to kind of help them out. She does that. She travels. So I call her up, and she's able to transport, go with my patients. So she flew out to South Carolina, traveled with them. She's a critical care nurse background. Arranged all the oxygen, all the supplies, non-rebreathers in case she ran into trouble. I created a whole binder with all her records and everything. So if, God forbid, something happened, it would be, identified early. She could be diverted to the closest hospital and they would have all of her records right there. And it really, the family waited, but they really had a lot of peace of mind knowing that there was someone there with them that could intervene if needed. Luckily, she did well. And no major issues. They did have some equipment issues with their oxygen that she was able to troubleshoot. But, it really gave the family peace of mind and it was less expensive than, hiring.
That's an option. You might be able to pay a nurse or somebody independently to make that trip like that. And that beats the scenario of the U-Haul and the air mattress. So, I've heard that scenario as well.
Exactly that. I would hire someone and just have someone in the rental van or whatever, a nurse that could be on state or wherever, and it's a lot more comfortable.
Sure.
Question: is there a conflict of interest if